Anesthesia units dispense a mixture of gases and vapors and vary the proportions to control a patient's level of consciousness or analgesia during surgical procedures. An anesthesia system comprises of a gas delivery platform, a data analysis and a distribution system, and physiologic and multi-gas monitors, which indicate levels and variations of several physiologic variables and parameters. Now let's discuss how it works. Anesthesia units uses a lot of O2 and N2O, oxygen and nitrogen gas. They are usually drawn from the hospital's central gas supplies. Vaporizers add a controlled amount of anesthetic vapor to the gas mixture. An automatic ventilator is generally used to mechanically deliver breaths to the patient. The ventilator forces the anesthesia gas mixture into the patient's breathing circuit and lungs, and in a circle breathing system receives exhaled breath from the patient as well as fresh gas. A scavenging system captures and exhausts the waste gases to minimize the exposure of the operating room staff to harmful anesthetic agents. Okay, this is how anesthesia units performs. First, I'll tell you how this machine looks like. Floor standing, or it is a benchtop device, which includes a rack or tray onto which the patient's blood samples are loaded. The samples are naturally mixed with some reagents to determine the blood type, and the results are displayed on a monitor. And there are also vessels inside it, a monitor, keyboard, mouse, a printer, and they may be connected for a programming data entry. Blood grouping system perform basic blood processing tests that include ABO grouping and subgrouping, even red cell phenotyping and antibody detection. This is how blood grouping system works. A blood tube containing ethyl diamine tetraacetic acid, or ETTA anticoagulant, is loaded onto the analyzer, and the operator usually centrifuges them to separate the RBCs from the plasma. So in the automatic or automated analyzers, typically they resuspend the RBCs in saline and load the diluted samples onto some microplates to which reagents are added. Blood group identity occurs when the non-anti-serum containing antibodies clumps the RBCs that have a corresponding. This is how medical professionals identify the blood group types. Aspirators or suction pumps. Most surgical procedures require suctioning to remove blood, gas, tissue, or other foreign materials, and irrigating the fluids that accumulate in the operative field and obstruct the surgeon's view. Portable or mobile aspirators can be used if there is no central vacuum system, or if suctioning is required in the areas that do not have vacuum inlets. So let's talk about how this equipment looks like. Surgical aspirators consist of a line-powered vacuum pump, a regulator or vacuum regulator, and a gauge, a collection canister, and an optional bacterial filter. Plastic tubing connects these components, completing an open-ended system that continuously draws tissue debris and fluid from the surgical field to the collection canister. The gauge allows the user to set a safe limit for suctioning, to assess the performance of the vacuum pump, and to detect leaks or blockages. Units are either portable or mounted on a stand or a cart for mobility. Working of aspirator is quite simple. Air is drawn from the external tubing into the chamber, drawing aspirate into a collection canister. Most surgical aspirators have an overflow protection assembly that prevents fluid from overflowing into the pump and valves. So guys, that's it. This is how aspirator works. Analyzer used to measure blood gas, pH, electrolytes, and some metabolites in whole blood specimens. They can measure pH, partial pressure of carbon dioxide and oxygen, and the concentration of many ions like sodium, potassium, chloride, bicarbonate, and metabolites like calcium, magnesium, glucose, and lactate. They are also used to determine abnormal metabolite and or electrolyte levels in blood and the patient's acid-base balance. The levels of the oxygen and carbon dioxide exchange too. Let's talk about the apparatus. It will be a handheld device or even a benchtop device, sometimes placed on a cart with a display, usually LCD, a keypad to enter the information, and a slot to insert a test strip or sample tube. Some models may have alarms, memory function, USB port to transfer data to a computer, and or a small storage compartments even for reagents. So how this machine works? The blood gas or pH analyzers use electrodes to determine pH, the partial pressure of carbon dioxide and the partial pressure of oxygen even in the blood. Chemistry analyzers use a dry reagent pad system in which a filter pad impregnated with all the reagents required for a particular reaction is placed on a thin plastic strip. The electrolyte analyzers use ion selective electrode or ISE methodology in which measurements of the ion activity in the solutions are made potentiometrically using an external reference electrode and an ISE containing an internal reference electrode. Okay.